Okay, great. Welcome everyone to our third UCT Pesticide Discussion Forum session for 2023. Just before we begin, we just want to go over some ground rules. So if you can kindly introduce yourself in the chat room, you'll find the speech bubble at the bottom of your screen. You can let us know your name, your job title, your organization, and your country. Please note that majority of the discussion will be taking place in the chat room. However, for the first 10 minutes of each section that we'll be discussing, the presenters will be presenting a few slides. So kindly can everyone keep their microphones and cameras off, and only the presenters will be able to speak and have their cameras on. If you're not a member of the UCT Pesticide Discussion Forum already, you're welcome to sign up with the link that has been provided in the chat room. We would just like to recognize Professor Andrea Rother, the head of the Environmental Division at the University of Cape Town, who is the forum moderator, as well as the Swedish Chemical Agency, who funds the Pesticide Discussion Forum. So today we'll be discussing the important topic of overcoming the challenges with reporting pesticide poisoning. We are welcomed today by two esteemed presenters, Gerald and Sheila, and we will begin the discussion with them introducing themselves shortly. I see everyone is already in the chat room, so just a friendly reminder for those joining us, you're welcome to introduce yourself in the chat room by letting us know your name, job title, organization, and the country you are from. Okay, great. So I would like to invite Gerald on. Gerald, you're welcome to turn on your camera and you may introduce yourself, and then you are welcome to move on to Sheila thereafter. Thank you.
Yes, good morning, good afternoon, Tatum, and participants of this discussion forum. As Tatum mentioned, today we will focus our discussions on overcoming the challenges with reporting pesticide poisoning. I am working in the Secretariat of the Rotterdam Convention, and I am located here with the FAO headquarters in Rome, Italy. Since many years, I am working in the Secretariat of the Convention, and as part of our technical assistance to parties and countries, we are, since many years, working with countries in order to assist them to identify problems under the conditions of use in the country with pesticide poisoning, and eventually reporting those problems to the Secretariat of the Rotterdam Convention. I'm very pleased to participate today as a presenter in the discussion forum. I'll have a short presentation towards the end, and we'll have the chat, and I'm pleased to respond and discuss with you any issues that you might bring up. With that, I would like to hand over to my colleague Sheila Willis. Sheila, you have the floor. Thank you very much.
Thanks so much, Gerald, and thanks to everyone for joining. Really looking forward to the discussion today. So thank you for sharing your time. I'm Head of International Programmes at Pesticide Action Network UK. I'm based in the UK, but we've got many years of experience of collecting information about acute pesticide poisoning in different regions of the world, and I'm delighted to have this opportunity to share some of that with you today. So without further ado, I think we can probably proceed with the presentation. Thanks, Tata. So as Gerald mentioned, we'll be talking about challenges reporting acute pesticide poisoning. But within that, we'll be talking a little bit about what it is and where information might come from, and the challenges collecting information as well as reporting it up the chain. So next slide, please, Tatum. So yeah, leading up to question 1, we'll have a little bit of background about the problem of acute pesticide poisoning, community studies that have been done in relation to the problem, some of the tools that have been developed and are available to collect information, and then a little bit of information about how that information helps. Beyond that, we'll move on to question 2, which is more about how that information is used, where it goes, where it's lost, and how it's shared and sort of moved up the chain, so that how it can help to inform decision making. So we'll start with the first part about collecting information on acute pesticide poisoning and the problem itself. Next slide, please, Tatum. Oh, that wasn't what I was expecting. Okay, thanks. So just a tiny bit of background about the problem of acute pesticide poisoning. What we're talking about here is the short-term health effects of exposure to hazardous pesticides. And opinions vary about that time window between 24 or 48 hours of exposure. When I'm sharing the work that Pan UK has done on this, we limit ourselves to the shorter window of 24 hours. And then just to mention, because it's important later on, that as we all know, a pesticide is an agent that is used to kill a pest, but because of that function, it's designed to disrupt biological processes. And those processes are often common to human beings as well, which is why they have health effects. And we're talking about a very wide range of chemicals that affect a wide range of biological processes across different organisms. So it's important to understand that some types of pesticides have quite different biological effects to other types. And that's important when it comes to diagnosis and reporting. And I've given a couple of examples here. For example, the organophosphates, carbamates, organochlorines, as a group, tend to be known for their impacts on the nervous system, because they tend to affect the transmission of messages across the synapse in the nervous system. So for that reason, they tend to have this group of symptoms around nervous system impacts, including headaches, in more extreme cases, loss of consciousness, muscle twitching, and so on. If you look at other groups of pesticides, you might get a quite different group of symptoms. And I've given an example here of some of the pesticides that cause hemorrhaging, such as the warfarins. That's their mode of action on rodents, but it also can have a similar mode of action on humans. So that's just by way of background. It's an important point to bear in mind later. Next slide, please. So to move on to the problem of acute pesticide poisoning itself, the most systematic review of this issue in recent years estimated that there are 385 million cases of unintentional acute pesticide poisoning annually worldwide, and that equates to about 44% of farmers who are poisoned by pesticides every year. So it's a huge problem. Bringing it back to what Plan UK has done, we've done multiple studies of the problem among groups of farmers. We studied, for example, in 2021, we surveyed just over 1,000 cotton farmers in northern Tanzania, and we found that 40% of them suffered acute pesticide poisoning over the previous 12 months. And we also disaggregated the symptoms and assigned them scores in terms of severity. 4% of those scored severe. The milder end of the symptoms would have been headaches, rashes, those types of things. More severe symptoms, I think, included convulsions, damage to eyesight, quite severe. And then we conducted a similar study of cotton farmers in Benin in the same year. There we got quite different results, much higher levels of poisoning and also severity. 41% of farmers reported severe symptoms that they'd experienced over the previous 12 months. And that tallied with some of the reports we were getting from medical services as well. So a very concerning problem. Next slide, please. Just to talk a little bit about the range of methodologies open to researchers looking at this problem to gather information that might be relevant. Of course, desk studies are always a good place to start. There's a both published literature, and there's quite a lot of literature, often in grey, the grey literature, internal reports and so on in institutions. Not always very accessible, but very important to look for. And then, of course, there's engaging with the community themselves, and this can be done in a variety of ways. Bottom right, you can see a picture of a group of farmers in Kyrgyzstan who were mapping out pesticide risks within their community, and that can be quite a revealing thing in terms of where a pesticide's stored, in what conditions, who might be exposed, how are they being used, where are people located in relation to that use. So you can get some quite useful background information from conversations like that. And those similar mapping exercises could happen at a slightly higher level or a much higher level, for example, within institutions mapping out resources and pesticide stores and pesticide use and so on. Another method is that engages communities is body mapping. In that black and white picture there, you can't see it very well, but you have the reference. That's the Murphy paper, who did some work with the FAO in Southeast Asia and engaged communities in mapping their own symptoms. So the way the method she used was to have regular engagement with the same community, where on a regular basis they recorded signs and symptoms of pesticide poisoning alongside information about which pesticides they were using and how. So over time you could build up a very rich picture of the community's experience of pesticide poisoning. Obviously that takes time. It's something that's done over a period of time, and it's a sort of deep dive into the problem at community level. The work we've done in former Soviet Union, for example, some of these pictures also involved consultations and group discussions with farmers. We also engaged with children to understand how they were using pesticides, and were quite shocked with the results, actually. And also people like extension workers, retailers, and others that have very useful background information. They don't give you direct information on the prevalence of acute pesticide poisoning, but they can give you very rich information about the sort of circumstances where poisoning might be taking place and routes of exposure. The picture in the middle on the top row shows a picture of a pesticide store. And this is a very common scenario, unfortunately, in many countries. This one's taken in Armenia, but it could very well be in a lot of other places, where pesticides are being repackaged into Coca-Cola bottles, plastic bags, and so on. So there's a very high risk of exposure for the pesticide retailer, the person that's handling the pesticides in the store, but also they're passing on hazardous pesticides in very unsuitable containers without labels, and that can be another source of risk. And then, of course, these kind of conversations give you information about conditions of use. Top right, you can see a not terribly good quality photo, I'm sorry to say, of somebody applying pesticides to their vegetable patch. And they're using just a bucket and a brush, and that was a very common occurrence in when we were looking in one part of Georgia, for example, but it happens in a lot of other places, and you can see that that's very far from the ideal way to apply pesticides and might be another route of exposure. So these are all kind of sources of background information. which are super useful, but don't give you that quantitative information. So on the back of that, we usually conduct quantitative surveys, and we may supplement that as well with empirical data. For example, you can see someone with a wristband here. These very simple silicon wristbands can be used to look at people, to measure people's exposure to pesticides, and we're sort of experimenting with those in Benin at the moment. The technique was established by the University of Oregon, and it seems like a very useful and easy field technique for looking at farmers, looking directly at farmers' exposure to different pesticides. But of course, it depends on having suitable laboratory facilities, which is not always easy. Next slide, please. So over the years, many survey tools have been developed to collect quantitative data at the community level. I've mentioned Helen Murphy already and her work with FAO. She did these body mapping exercises and developed several tools around that, but also more sort of classic survey tools have been developed, for example, TOW in Burkina Faso, and I think I shared that reference with you. And over the years, Pan UK has also developed many of these tools, and also Pan Asia Pacific has developed some very useful community monitoring tools under their CPAM program, which we can happily share. Initially, we developed these for use on paper, as in top right in Kyrgyzstan, but we've used them across Africa and in the Caribbean and many other places. And then we moved on to, depending what was available, Excel spreadsheets, putting them directly in there. But in the last 3 years, things have moved on with access to smartphones in remote rural areas. So we're now looking at more clever digital tools. Next slide, please. So Pan UK has developed a smartphone app called TMAP. There's a link there if you're interested to find out a bit more. It's based on working with epidemiologists, and the advantage of that is it's more efficient. It also collects data in a much more standardized way. Across different locations, we can use different languages in the same app, which is very helpful. So it's time saving. It can work offline and submit data once connectivity is restored, which is very helpful in rural areas. And another great advantage is that it can generate some basic analysis automatically. So that data can feed automatically into a dashboard system, which generates that analysis in real time, which is super helpful. Next slide, please. So we've used the app at the moment in 5 countries and in 6 languages. We're rolling it out to 5 more countries over the next few months. And our partners in that work include FAO, government regulators, universities, sustainability standards, and other NGO partners in those countries. Next slide, please. So just to talk a little bit about how does that information help? How does it inform decision making? Why are we collecting it? Just to give you some examples, we've found that the data helpful in trying to identify which pesticides in particular are associated with incidents of acute pesticide poisoning. Of course, individual one-off incidents, it's difficult to put a lot of weight on because you're relying on one person's testimony. But if you're able to collect data at scale, then you have a much clearer picture of which pesticides are causing problems repeatedly and repeatedly reported. And so we take that sort of weight of evidence approach. In Trinidad, the information has been used by the national authorities to phase out several highly hazardous pesticides. And we're also working in collaboration with the Pan American Health Organization, which is a WHO organization for the region, and contributing to a regional study of acute pesticide poisoning. We'll be working with FAO in Central Asia over the next 18 months to do this, a similar exercise. In Sri Lanka and Nepal, we're partnering with the national health authorities who are concerned about the problem of acute pesticide poisoning, and that would link into their sort of response within the health services. We've also used it to identify risky practices. For example, with a sustainability standard in India, we realized that a lot of people were reporting mixtures of pesticides causing them severe health effects because they were using cocktails, you know, mixing them within the same spray tank. And so that triggered an information campaign to try and help farmers be more aware of the risks from using cocktails of pesticides for their health. And we're also using it to hone in on vulnerable groups. You know, it's very easy to disaggregate the data based on age, on gender, on location, also on occupation, distinguishing farmers from farm workers, for example. Next slide, please. Oh gosh, I think I'm running over time, Tatum. I do apologise. I'll speed up. Next slide. Okay, great. So we'll go to question 1. Over to you for some thoughts. We'd love to hear, and you, if you could share any efforts you're aware of for collecting this type of information concerning acute pesticide poisoning in your country.
Thank you very much for that informative presentation, Sheila. Yes, so the question we are discussing is list and describe any efforts you're aware of to collect information concerning acute pesticide poisoning in your country. In your response, you can put in your country or your organization. So we are continuing the discussion in the chat room. So everyone is welcome to move over to the chat room now, and you may provide your responses to question 1. And Shirley, you're welcome to keep on your microphone and you can respond to the questions. I see we have a first question already from Kyra Pauly.
Yeah, that's great. We are going to go on and talk about the sort of institutional level and how poison centres fit into this whole picture. So in this first part, I was just focusing on how you get information from the people who are impacted by acute pesticide poisoning. But we'll certainly come on to the issue of poison centres. I think they're a very important sort of piece in the puzzle. How do we ensure there are no fake entries? Well, just talking on in relation to our work with the app, we do have quite a few levels of quality control. For example, we can look at individuals who are submitting data and look at the patterns of data submission to see if there are outliers there. We also look for consistency in responses and contradictory responses. So we plant a few questions that should tie up with each other, and if there are contradictory responses, that would raise questions. And another thing we do to sort of validate it or just check is to look at the range of symptoms that you would expect versus what's being reported in relation to a particular product. So, you know, I mentioned that certain groups of pesticides tend to have certain types of symptoms, and if you're getting something very different, then that would raise questions about whether people are reporting in relation to that pesticide exposure or whether they're using other pesticides at the same time, or it would trigger a bit more explanation. We also put in the don't know option because we're really keen that people don't respond with something concrete when they're actually not that sure. And often people are quite keen to please when they're responding to surveys. So we try and do that. And then, as I said, we rely on weight of evidence. If we have you know, a lot of people pointing in the same direction, that just gives us that much more confidence that what we're saying is robust. Oh, I've got a few more comments coming in. Sorry, I'm not keeping up with them. Yeah,
There is
Tanzania. Sorry.
Oh, sorry, Sheila, I just want to say, well, before you respond, there is a poll on the screen, and so while you are responding to the questions in the chat room, the link to Mentimeter will be posted, and the participants can respond to the poll on the screen as well. Sorry, over to you, Sheila.
No, that's great. Thank you. Really interested in these responses. It's hard to keep across them all. Yeah, the Tanzania Poison Centre meant a comment from Dr. Ngawi. Yes, it can be hard to access information from poison centres. We'll come on to how information is shared. It can also be hard for poison centres to access the information they need, you know, to build up a complete picture. So that problem of information flow goes both ways, I think, and they do have a difficult job pulling that data together. But clearly, for it to be useful, it'd be great if they shared it across all the concerned stakeholders that need to see the data that they're collecting. Debbie, you've said that it's only recorded as a pesticide poisoning and not which pesticide. That's a very common problem. It's not one that the survey tools I mentioned suffer from, but it is a very common problem when people, and again, I'm going to talk about that a bit in a minute, when people report to health services, often the particular pesticide that they're suffering from exposure to is not recorded, and that's for various reasons. Partly because of the reporting system, a failure of the reporting system, you know, it doesn't ask for that information, but also partly that health professionals may not know to ask that question, or you know, sometimes the person involved doesn't know the answer anyway. So there can be various ways that very valuable information drops out, unfortunately, and that's one reason why these community-based tools have been developed, to try and fill some of those information gaps. Oh, we've got the Menti poll, lots of answers coming in, thanks for that. Unfortunately, a lot of countries with no surveillance reporting systems in place, and then poor coordination between institutions. Yeah, we've mentioned that in relation to the poison centres. That's definitely an issue. Lack of technical expertise, yeah, and that can cut across lots of different institutions as well. Lack of awareness of the problem. It's a bit chicken and egg, that one, isn't it? The lack of awareness of the problem. If there's no way of measuring it, it doesn't become apparent to people that there is a problem. I've spoken to some regulators who've said, oh, we don't have a problem of pesticide poisoning in our country. And I've sort of said, well, if you did, how would you know? You know, there's no system in place to verify that. So it's a bit of a chicken and egg problem. Yeah, poor misdiagnosis. Yeah, it can be a difficult thing to diagnose, and frontline staff don't always have the skills or the training that they need for that. Yeah.
Thanks, Sheila. Before I move on to the next poll, do you have any concluding thoughts on this one?
I think we've got a really nice conversation going, lots of things in the chat, and I'm sorry I'm not getting across all of those, but I think it will lead really nicely to the next part anyway, so we can continue.
It'll just be the next poll question. So the poll on the screen is asking, should exposure to pesticides that cause chronic health effects be monitored? Answered yes, no, not sure, and explain your response. So I think we were talking about acute pesticide poisoning, and so this poll is asking about the chronic health effects or the long-term effects. Should that be monitored? So you're welcome to respond to the poll by clicking on the Mentimeter link in the chat room or going to www.menti.com using the code on the screen. Sheila, I see Debbie mentioned mortuary data. Is that data that is often used for surveillance and reporting, or what are your thoughts on that?
I think that very much depends on the country. In South Africa, I know that Professor Rother has done a lot of work on that, and that you have a good system of looking at the causal agents, and that can be very useful. And of course, very sadly, people who have the most extreme, impact of acute pesticide poisoning, and it's a fatality, they're not available for the surveys. So it's very important that we pay attention to that information. But unfortunately, those systems are not available universally. And I'll mention in Benin that wouldn't work under the current system in Benin, because death certificates are optional and they need to be paid for by the family, and there are not the laboratory facilities to do the tox analysis, so the causal agent is almost never recorded, even if the family go to the extent of requesting a death certificate and paying for one. So it's horses for courses, but I'd definitely say if there's good mortuary data, then that would be super valuable, and shouldn't be overlooked. Absolutely.
Thanks, Sheila. We have time for one more comment if you'd like to make on anything in the chat room.
I noticed that a lot of people are mentioning that some studies have been done, or that there's a problem getting information. So we'll definitely be coming on to those issues in the next part. Yeah, the lack of labels is definitely a problem, and I mentioned that repacking of pesticides into unlabeled containers. Also, if labels are unreadable, they become damaged, or they're in the wrong language, or for whatever reason. There's a lot of reasons that farmers might not have an accurate understanding of what they're spraying, and then that blocks everything from that point forward. You can't know what they've been exposed to, and that's a very significant problem.
Great, so we've reached the end of question 1. Sheila, you're welcome to make any concluding comments to either the poll, the chat room, or just in general, and then we'll move on to question 2. Thank you.
Thanks so much. Yes, well, there seems to be a lot of keen interest in the problem, and an understanding that it's a widespread issue that needs more attention. But also raising a lot of issues about why it's difficult to collect the data, or why it's difficult to see the data. In terms of chronic health effects, of course, they can be more difficult to monitor. In terms of acute pesticide poisoning, that's in some ways the low-hanging fruit, although we've been talking about some of the difficulties. Chronic health effects might be even more difficult to understand, and definitely need some attention and some epidemiological studies, some long-term studies. So yeah, and I can see that there's widespread agreement that definitely needs attention. So I'm happy to stop there and move on, unless there's a particular comment you want. Okay, thanks, Tayton. So having spoken a bit about some of the tools that can be used at community level and the approaches to getting information, we thought it might be helpful to talk about where that information goes, how it's pulled up to decision makers, or where the blockages might be. So we'll talk a bit now about reporting acute pesticide poisoning. Next slide, please. For reasons that we've already touched on, acute pesticide poisoning is severely underreported and under-researched. Just some more evidence of that. The Pan American Health Organization, for example, undertook a study in 6 Central American countries and found that only 1 to 20% of cases of acute pesticide poisoning were officially reported. FAO also did some research some years back and found very low levels of reporting in Cambodia and Vietnam. So it's a very widespread problem. Pan UK did a sort of literature search in 2017 on pesticide poisoning in relation to cotton, which is a crop that tends to use a lot of pesticides, and it just found 35 peer-reviewed papers produced over the previous 16 years on this topic. So very under-researched, very under-reported. Next slide. Just some more evidence of that in Tanzania. A study in 2016 said that data suggests that farmers do not see health facilities as accessible or suitable for dealing with occupational pesticide poisonings. So the consequence of that was that low numbers of farmers were actually presenting at health services, and then of course there's no way of recording those within the health system at least. And Pan UK has also found very low levels of presentation of acute pesticide poisoning to medical services. We did studies in 6 countries in Eastern Europe and the Caucasus, and across those 6 countries, between 4 and 19% of incidents were presented to medical services only. In India, we found 24% of incidents were presented to medical services. In Jamaica, again, 24%. In Trinidad, 11%. In Tanzania, you might just be able to see from the graphic below that a vanishingly small number of small percentage of farmers in cotton farmers in Tanzania were presenting to medical services. Rather more in Benin. I think I can barely read it, but I think it was 34% in Benin. Yeah, 34%. But still, a huge proportion of farmers not even presenting to medical services with those incidents of acute pesticide poisoning. This partly explains why so many efforts and methodologies have been developed for community-based monitoring, because extra effort needs to be made to fill that information gap. Next slide, please. Another problem can be that when people do present, as we've mentioned already, those incidents might not be adequately recorded. We did some work in Benin we have ongoing projects there, but 2 studies we put together. One in 2019 looked from what farmers were experiencing, looked at local health clinics, hospitals, and national level reporting systems to see where that information was going and whether information was getting through to people who needed it at the national level, decision makers. So in that one case, and I don't think Benin is necessarily that unusual, but in that case, 84% of conventional cotton farmers reported suffering from acute pesticide poisoning in the previous 12 months. Of those, 34%, as we just saw, sought medical assistance, either from local clinics, from local pharmacists, from a range of health providers as well as hospitals. When we went to the hospital, we found that the hospital records were summarised on a monthly basis, but not digitized, and those monthly reports were collated and sent to the national epidemiologist, who kind of was linked into the national pesticide regulatory system. But those summary reports that got to the national level only ever included incidents of mass poisoning, where, for example, families had accidentally put pesticides in their food from by mixing it up with a pesticide bottle, mixing cooking oil and pesticide bottle. So a whole family might be affected. Similarly, there were incidents in restaurants where that sort of incident happened, and they were the only incidents that were reported at national level. So there was no mechanism at all for individual farmers suffering acute pesticide poisoning being reported up to the national level. And we've already talked about the problems with death certificates as well. Again, in the case of fatalities, there was no mechanism for recording the cause of death and reporting that up to the national level. So the vast majority of information is being lost before it gets to the national regulatory authority. And for understandable reasons, they're then fairly blind to the problem. They're not aware of the scale of the problem, or which pesticides are causing the problem, or the fact that action is needed. In fact, at the national level, one person said to me, but cotton isn't a food crop, so why do we need to be concerned about hazardous pesticides being used in cotton? So there's a definite blind spot around this, and it's understandable given the lack of information available to people. Next slide. So there's the problem of reporting to health services, but there's also the problem of what happens to information once someone does report to the health services. And we know that data on acute pesticide poisoning is poorly reported, and the circumstances, the nature of that exposure are poorly reported and recorded. So as we've said in the chat, I think someone mentioned that often the specific pesticide is not recorded, the circumstances are not recorded. And a study that I've mentioned already in 2016 found that just 5 out of 112 farmers who reported attending hospital due to acute pesticide poisoning could be traced in the medical records. So a huge amount of information being lost already at that level. There's also a problem of the lack of diagnostic skills among healthcare professionals, which undermines the health surveillance system. And studies have been done in Tanzania, but it pertains elsewhere as well, that frontline healthcare professionals are not very aware of what the problems are with pesticide poisoning. And partly that's understandable in the sense that it's not an easy thing to diagnose, given what I said earlier about the whole range of chemicals that we call pesticides, and the vast range of signs and symptoms that they can inflict on people. It's not all that surprising that frontline medical professionals find it difficult to make a good diagnosis. But we know that they really could do with more training in this, particularly in rural areas where it's a prevalent problem. And then again, a similar study conducted in the US of primary healthcare physicians also revealed poor knowledge of health risks associated with agriculture and recommended more specific training. So, you know, it's not just the under-resourced countries that are suffering this problem, but I'd say it's much more acute in those countries. Next slide, please. We mentioned poison centres. Well, before I get on to that, laboratory facilities are often lacking, and that can be a real hindrance in identifying the chemical that's caused the problem, confirming the diagnosis, or we also mentioned in relation to death certificates. So again, that's another reason data is missing and underreported. And we mentioned a lack of expertise and a lack of institutional coordination. A lot of piecemeal studies, bits of information in different institutions not being brought together. And that could be a really valuable role of the poison centres. This map shows, it's the latest map on the WHO website of where poison centres are located. And you can see that there are a lot of gaps, particularly in Africa, parts of Latin America, yeah, a lot of gaps across the board really, but particularly in those geographies. Next slide, please. One study that we did with UNEP was looking at sources of information that already exist, you know, so thinking about this idea of improving coordination between institutions that have part of the picture but are not putting it all together with other institutions' data. So we looked across the board at sources of information about chemical hazardous chemicals, pesticides in particular. All of the 7 countries that we looked at in Africa were using the standardized WHO health information system, and it had very good coverage. For example, 85 to 90% coverage in Kenya and Zimbabwe. But that system doesn't ask for specific information about poisoning. It just has a tick box on poisoning, and it doesn't break it down into pesticide poisoning, let alone which pesticide. So we would love to see new iterations of that system where we could get a bit more granular information on poisoning. Poison control centres, only 2 out of the 7 countries had one. And again, there were problems of them accessing the information that they needed to collate, and also the level of detail that they were putting together. And then, as already been mentioned, in Tanzania, there's it would be great if they could share the information that they have a bit more openly with other institutions that need sight of it. We talked about other sources of information, for example, GMP is the POPs monitoring program. It was being conducted in 5 out of the 7 countries. Of course, very limited number of POPs pesticides that it looks at, and the data is not very accessible, but there is some monitoring data going on, being collected there. Environmental, not human health. And again, you can see there's some other sources of environmental or food, water contamination data being collected that might give another piece of information in this whole picture, but doesn't directly measure the prevalence of acute pesticide poisoning. So lots of bits of data around, but not being shared terribly well across institutions or put together. Next slide, please. So just finally, I wanted to alert you to some useful tools if you're interested to pursue this a bit further. I'll just quickly touch on the severely hazardous pesticide formulation notification, which Gerald is going to talk much more about in a second. The WHO pesticide exposure record similarly gives a useful basis of the type of information that you might think about if you're looking to collect information on incidents at a national or more local level. Next slide, please. And then I just wanted to point you to a couple of guidance documents as well that might give you a broader picture. But again, Gerald will touch on the SHPF toolkit in a moment. So I will stop there. Thanks a lot.
Thanks, Sheila. So everyone, we are now going to be discussing question 2 in the chat room. You're welcome to post your responses. Just a friendly reminder to add your country in your response. And yeah, thanks again for the presentation, Sheila.
Yeah, coming up in the chat, some of the institutions, we haven't mentioned police, but of course some of the enforcement agencies would have some information as well. To be so saying so much as reporting systems may be there, I don't think they're efficient, and the use of corporate capture also makes it worse for pesticide regulators. South Africa. Okay. Yeah, I think we're going to talk about whether there are mechanisms in place to capture this data, but we're getting the sense that they're pretty absent. And then I'm not sure about your point about corporate capture and the regulators. Are you saying that even if they got the information, they may not pay attention to it? Is that the point you're making, or? Tanzania, no reporting system. Yeah, that's such a shame, because I know, Vera, that you've made efforts to establish one in Tanzania and on a pilot basis, and it's a shame it hasn't been sort of taken up at a more institutional level. Yeah, Christopher Kanema mentioned the ChemObs project in Zambia, which is the one I mentioned about looking across different institutions, collecting information about countries.
The poll is on the screen, so the participants are welcome to respond to the poll and continue to respond to the question in the chat room. The link for Mentimeter will be posted, or you can go to www.menti.com and use the code that's on the screen.
Oh, this is interesting, yeah. And if anyone has other suggestions, someone's already mentioned police, which I don't think are listed in there. Please feel free to add those in the chat. Yeah, most people saying no formal reporting system. Oh, we do have police in the Mentimeter. Interesting. So health services are coming out highly, and poison centres, Ministry of Agriculture. So I guess the question is there, how well how effectively they're capturing what is needed to take action, whether it's being shared across institutions. Yeah, interesting. A couple of people have ticked the Ministry of Labour and Social Affairs. Of course, occupational health and safety could encompass occupational pesticide exposure. And the ILO they made a new resolution last year about the importance of health and safety in relation to chemical exposure. So this might be an issue that comes up more strongly in that sector as well. Gift has mentioned that in Nigeria, the National Agency for Food and Drug Administration and Control is a broad agency that isn't really capturing what's needed on pesticides. Unfortunately, a lot of the time we find there's a real focus on residues of pesticides on export crops, but domestic consumption is a bit neglected in relation to that, which is more about consumer exposure than occupational exposure, but that's still a concern.
Sorry, Sheila, I'm not so sure if you saw the question earlier where Placido asked if the T app is free.
No, but we don't charge for the app itself, but there are, for example, if we need to put in a new language or we need to support staff to use it, then there's a bit of a charge just to cover costs for that. So the app itself is free, but there are some costs around using it that are not free. But we'd be happy to have a chat about whether that's a doable thing or not, and we'd be, we'd welcome interest in that, and we could have a chat about how that could be managed.
Yeah, I see he's saying he wants to implement it in Colombia for farmers to report poisonings.
Well, very happy to talk about that. Absolutely.
Okay, great. Can I move on to the next poll? Would you like to make any comments to the one on the screen?
To the Mentimeter, yeah, we've got health services coming in very strongly. So they, of course, do hold information about acute pesticide poisoning, particularly the more extreme incidents, the more severe incidents. But as we've said, perhaps they're not recording it as well as they might be because of lack of training and focus on that issue and lack of systems. And then are they sharing it with the people who need to see it in a way that will be useful to them, such as the pesticide regulator? Tatum, you're welcome to share my email in the chat room. I can put it in.
Thanks, Sheila. So we have about 3 minutes left to conclude this question. There's another poll on the screen, so you're welcome to respond to it. The link will be posted in the chat room. Sheila, do you have any concluding thoughts on the chat, the conversation?
It's been a really interesting conversation. So much engagement. I'm really grateful to everyone that's participated. A slightly depressing picture is emerging that there are a lot of gaps in information and a lack of systems to collate that information. But it's encouraging that there's so much interest in the problem, at least among the participants here. So, we can be hopeful that people will take an interest as they move forward. But definitely a need for a bit more action on the data collection side so that we really understand this really massive problem.
Thanks, Sheila. And I see on the screen on the poll that most of the respondents are saying yes, that mortuary data on pesticide poisoning and toxicological results should be used for regulatory decision making.
I think if information is available, then if it's reliable information, why not use it? But maybe the no's are concerned about whether it's actually available or not in some circumstances. If I'm misinterpreting that, you're welcome to put something else in the chat.
Okay, great. I think with that, we will be moving on to question 3. Thank you so much, Sheila, for taking us through that and for the extensive explanations. It's fostered a very engaging discussion in the chat room, so thank you very much. And then I will hand over to Gerald to take us over question 3.
Yes, thank you very much, Tatum. And I think Sheila has covered already quite a broad area of problems related to reporting pesticide poisoning. I want to present another aspect on pesticide poisoning and basically start with a very positive note, which is since this FAO code of conduct was adopted for the first time in 1985, so about 37 years ago, I think all stakeholders have really contributed a lot to make pesticide management safer and reduce the undesired effects on human health and the environment. However, as Sheila also has pointed out at the very beginning, unfortunately, we are again far away from achieving our goal, which would be using those chemicals that are required to produce sufficient food for a global population, but in a way that they have hardly any negative impact. And now I want to focus on the Rotterdam Convention, which was negotiated between 1996 and 1998. And in negotiating the Rotterdam Convention, delegates, of course, included a process for developed countries who have the capacity to do a risk evaluation. And during that discussion, it then also became evident that there is also a large number of countries, particularly developing countries and countries with economies in transition, who actually do not have the capacity to conduct a risk evaluation, but still they have problems under the conditions of use. Next slide, please. So in negotiating that convention text, they then identified something that was called severely hazardous pesticide formulations. And this is the Article 6 of the convention, and the definition is in Article 2. Now, under the Rotterdam Convention, what is a severely hazardous pesticide formulation? According to the definition, it's a chemical that is formulated for pesticidal use. It's something that produces severe health or environmental effects, and those effects are observable within a short period of time. So it's single or multiple exposure. And important is that it applies under the local conditions of use, which is something that can be quite different from the label description. So this is what is described under the Rotterdam Convention as a severely hazardous pesticide formulation. Now, in the next slide, I would like to present you the process. Under the convention, there is a process for parties, countries that have ratified the convention, to propose severely hazardous pesticide formulations. And of course, it starts with the country, the party, that is experiencing problems with certain pesticide formulations under the local conditions of use in their territory. Basically, the designated national authority should submit such proposals to us, to the Secretariat. The Secretariat would verify the information and collect additional information, and then send it to the Chemical Review Committee. Next slide, please. So it's already here, we see it's a two-step process. The country collects information, sends it to the Secretariat. The Secretariat collects, verifies it, and collects additional information. Then the Secretariat would send the full documentation to the Chemical Review Committee, and those 31 experts would verify the information provided, and eventually, if all criteria are met, would send a recommendation to include this severely hazardous pesticide formulation in Annex 3 of the Convention to the Conference of Parties for adoption. So this is basically the process. Any country that is collecting poisoning information shares it with the designated national authority. They would forward it to the Secretariat. We will forward it to the Chemical Review Committee, and they will make a recommendation to the Conference of Parties. At the next Conference of Parties, for example, which will take place the 2nd to 13th of May 2023, there are again 2 formulations on the agenda, and the delegates will have to decide whether to accept the information and list it in Annex 3 or not. And the 2 substances are fenthion, ultra-low volume formulations of 640 grams active ingredient, as well as paraquat iron of 200 grams per liter, just to give you an example. Next slide. So in that process, collecting field data, the Secretariat has, for example, prepared 2 forms, one for human health incidents and the other one for environmental incidents. On the next slide, you will see what type of information is required. According to Annex 4 of the Convention, the party, the country, should provide a description of the formulation used, which would be the name, the active ingredient, the amount of active ingredient, and the type of formulation. It should also provide a description on how the formulation was used and a description of the incident or the impact on human health or the environment, and eventually any control measures that were taken or proposed. Now, that's the information that the designated national authority should provide to the Secretariat. Next slide, please. In order to collect this information, the Secretariat, with support from PAN, for example, has developed a severely hazardous pesticide formulation toolkit, which is a kit that provides a vast number of documents on how to structure, how to prepare a survey, how to collect the information, how to validate, how to evaluate, and how to submit that information. So this interactive toolkit is available from us, the Secretariat, but of course it's also as an interactive toolkit available on our website under pic.int. Now, as a first step, we, the Secretariat, we are assisting countries in conducting field surveys. Next slide, please. And basically, in preparing for a field survey, with our assistance at the country level, those implementing the field survey would take a number of preparatory steps, probably organize an inception workshop, do some training of trainers and enumerators, then go out into the field and collect the information, review the information, and have a workshop in order to evaluate that information. And this is the kind of activity we as a Secretariat, FAO and UNEP, are supporting countries in doing that kind of information collection. Now, once the country has that information available, the Secretariat, next slide please, the Secretariat would then provide additional information. For example, the exact properties of the formulation, handling restrictions in other countries, information from other countries or other organizations, and the extent of use of that formulation. Next slide, please. For the country, it is important to stress that the designated national authority of the Rotterdam Convention can draw upon technical expertise from any other relevant source in the country. So they can make use of information which might be somewhere in your country with somebody, as you indicated in your responses to Sheila's question. And next slide, please. That form, which I have showed at the very beginning, basically has two parts. Part A is a summary, and that Part A has to be signed by the designated national authority under the Rotterdam Convention when submitting that proposal to the Secretariat. And the Part B of the form is basically the pesticide incident report form, with all the areas of information that are required. And I think important is that this form can be completed by other entities, as well as by NGOs or through poison centers or health centers and so on. And in theory, that form, Part B, can also be replaced by other national incident reporting forms if they are available. Now, once the country, the designated national authority, submits it to the Secretariat, next slide, please. Secretariat is invited to review the form so that it meets the information requirements of the convention, collect additional information, and forward it to the Chemical Review Committee for consideration. Next slide, please. Now, summarizing what we have been doing over the last few years, for example, the Secretariat of the Rotterdam Convention has worked with 16 countries to implement surveys in order to report and propose severely hazardous pesticide formulations. Now, during the pandemic and also as a regular additional tool, the Secretariat also is organizing webinars in 5 to 6 languages on that opportunity to propose severely hazardous pesticide formulations. And as a matter of fact, during those last 4 years, the Secretariat has in fact received 15 proposals. And certainly our resource kit was very useful. Also, the fact that we provided technical assistance was very helpful to those countries. And as a result, as of today, we have 3 severely hazardous pesticide formulations listed in Annex 3. Next slide, please. Here you will see a few countries and a few pesticide formulations that have been proposed. The yellow shaded are already in the convention, and all the others are proposals that are somewhere pending in the process. So you can see that, for example, Senegal was in 2001 already the first country to make a proposal, and that combination is now listed in Annex 3. Others, like Burkina Faso, they have submitted the proposal and it is still pending for adoption at the Conference of Parties. Also, Chad has provided a proposal on ULV of fenthion, and this is pending with the Conference of Parties. Just to give you an example that the process is working. Of course, it could work much better. And next slide, please. That's why we also, together with Sheila in the previous presentations, we are also looking at the challenges. 15 proposals is quite something, but considering that we have probably, Sheila mentioned the figures, we have hundreds of millions of acute pesticide poisoning cases, and unfortunately also thousands of mortal cases. That draws, we have to draw the conclusion. So 15 proposals is the least we can expect if we have millions of pesticide poisoning cases. Of course, what are the challenges? basically, one challenge at policy level for governments is that the framework is not very supportive to collect this data. Or, as we all agree, poisoning incidents are not well documented, even in hospitals. Under the Rotterdam Convention, we would need the pesticide formulation, and that's often not recorded. Another problem is that the designated national authority under the Rotterdam Convention is not really very well connected to the field where the pesticide poisoning happens. It does not happen in the poison control center, and it does not happen in the hospital. The poisoning actually happens in the field, which might be very, very far away from any center that could give any support. And also, unfortunately, we still have to note that often there is a political will, a lack of political will to submit proposals. Next slide, please. Now for our designated national authorities, what are challenges? For example, there are a few challenges here. They have limited knowledge of the process to submit such a proposal to the Secretariat. They are not familiar with the form, because national authorities are changing frequently. Also, they were trained, they are changing, and we are working with national authorities who are not aware of the form, who have not been trained. And often enough, they only find anecdotal information on poison incidents, and that's certainly for the criteria of the convention not good enough. One of the key constraints in our view is really that there is no efficient link between the designated national authority and the collection of information on pesticide poisoning incidents. Next slide, please. So in concluding, what are the benefits of proposing a severely hazardous pesticide formulation system? One is, if a country submits it, the other 165 parties take note that there is a pesticide formulation that is causing a problem. So it's an early warning system. Parties can make better informed decisions regarding that pesticide formulation, and they can, at national level, most importantly, they can strengthen their efforts to reduce risks from such pesticide formulations, because that's the first objective, reducing the risks from these hazardous pesticide formulations. Of course, they would such proposals would also protect the environment. And next slide, please. With that, I would like to thank you for listening to that presentation. And we still have some time to focus on the third question. And I would like to hand over to Tatum to facilitate that part. Thank you very much.
Thank you very much for that very detailed processes and just going through that with us. So we are now in the chat room. Everyone, you're welcome to respond to question 3 that is on the screen. We will shortly be posting a poll as well, where you can click on the link that will be provided. If you have any questions as well for Gerald, you're welcome to post it in the chat room. Thank you all. So you'll see some people have started to respond to the question. If you have any comments, you're welcome to provide them.
Well, certainly the farmer is key to that whole process. And if our primary objective is to avoid any negative impact, that can only be, first of all, achieved by educating the farmers. on how to reduce the risks in resulting from the use of hazardous pesticides. And that would also involve sharing information with farmers that they can report in individual countries to individual institutions. They can and should actually report their pesticide, the poisoning they suffered from. And only then a process like an international convention can take place. And also only then the registrar in the country or the authorities in the country would really have a basis to take action. Now, of course, there is the very serious question, why using pesticides at all? We have many activities and many approaches like integrated pest management, where FAO is playing, is a key player in providing training through farmer field schools and techniques. So integrated pest management for FAO is certainly a way to produce sufficient food, but use only the minimum quantity required to do so. Now, I think we can already look at the poll. I offered you the 3 types of information that are required under the Rotterdam Convention. And there seem to be our participants, with all their experience they have in that area, there seems to be a very strong position that the key problem under the Rotterdam Convention is this clear description of the incident related to the problem. We can work on that. And Sheila and Pan, for example, they have given now another example of how you can make it easier to provide a clear description. For sure, there is further work necessary to make it easier for anybody to provide a clear description. But actually, in the form, we also have already kind of tick boxes, and that makes it easier to describe what actually had happened. And the experts in the chemical review committee are also coming from your country, so they have a fairly clear understanding of how the situation is in the field and in the countries. And insofar, they, knowing what the situation is, they will also evaluate the information that was provided, taking into account the local situation.
And now the poll has been posted, and so it's asking the participants if you're familiar with the process for countries to submit a proposal for a SHPF. Please list your country in your response as well.
Yes, I think one clarification I have to provide here is the severely hazardous pesticide formulation is defined as the type of formulation and the concentration. So that's pretty clear to chemical experts that we need the name, the chemical name, as well as the type of formulation and the concentration that caused the pesticide poisoning. That often enough is quite difficult for farmers to report, but fortunately, pesticide containers are still very often labeled, and that's why in reporting under the Rotterdam Convention, a severely hazardous pesticide formulations, attaching a copy of the label describing the pesticide formulation that was used is quite essential and helps a lot in the further process of verifying the information provided and preparing a recommendation to the conference of parties.
See, we have many no's on the poll. If you could just list your country in the chat room for us to see which countries those are in.
I also mentioned briefly that we actually have two forms. One is prepared to assist countries in reporting human health incidents. There is a second form, and actually the convention allows a second procedure for environmental incidents. But so far, as we are struggling with human health forms, we have not really engaged in reporting environmental incidents because they are still quite a challenge. Now let's look here on the poll. Yes, of course, that's what I expected. Far too many colleagues that are actually very interested in the in the problem, pesticide poisoning. They're interested. They are probably working in that area, but yet they are not aware of the process established under the Rotterdam Convention. And that, of course, should give us, again, is the basis for doing more. And I think that's also kind of my conclusion, as we are running short of time. As I said at the beginning, we have, thanks to very active participation of all stakeholders, I think we have achieved a lot over the last 30 years, but there is nothing else to say than we have to continue and even increase our efforts to share that information, collect that information, and also occasionally do that additional hurdle and present the information to the pesticide registrar as well as to the national authority and maybe even to international organizations who are very keen in getting to know about the pesticide poisoning that's happening and who have the necessary means to work on that and share that information globally so that other countries can take risk mitigation measures and ensure that what happens in one country is not happening in all the other countries. With this, Tatum, I would like to give the floor back to you. Thank you very much for all the questions, proposals, and information that participants were sharing with us. Thank you.
Thank you, Gerald, and thank you, Sheila, for leading such an engaging conversation today. I think it was a very important topic, and as we can see, in many countries, so many people are interested in knowing more on it. So thank you very much for that. As everyone will see, there is an evaluation poll on the screen. We ask if you can kindly complete that for us. This will just help inform our work going forward. And then thank you to all the participants for just being lively in the discussion and asking very important questions and providing comments for us. We again just thank Prof. Andrea Rother, who provides the support for the forums, and then as well as Naomi Chitzer from the University of Cape Town, who's providing background support. We will have a next discussion, so the fourth discussion for the UCT pesticide discussion forum will be on the 6th of April, and that will be on EPR schemes for pesticides, and the presenter will be Colin Lang from the French Environmental Agency. So we will post the registration link in the chat room, and then we as well will be sharing a digest and the transcript of the session with all people who are signed up to the discussion forum. So we'll provide a link for you to sign up if you have not done so already, and you will receive a digest and transcript, as well as the recording and the PowerPoint presentation slides. So with that being said, thanks again, everyone, and wishing you a good rest of the day.
Thanks so much. I think it was great to see so many people join. Thanks for facilitating that, Tatum.